All right, everyone. Thank you so much for joining. Welcome to RegenMed Global, the podcast, where we bring you the latest and greatest in the field of medicine. My name is Cheyenne. Today, we're here to go and learn about stem cell therapy. That's our first topic. And to speak with us about this topic, we have one of the leading clinical stem cell therapists in the country, the founder and chief medical officer of Innate Healthcare Institute located in Phoenix, Arizona. We have Dr. Travis Whitney. It's a pleasure to have you, Dr. Whitney.
Thank you so much. What a great introduction.
Thank you. Before we get into stem cell therapy, obviously, I want everyone to go know who you are. So do you mind maybe just telling us a little bit about who you are and what got you into the field of medicine?
Oh boy, yeah. So I grew up in Northwest Florida. I worked on the beaches out there for quite a while. And after my first degree, which was in psychology with a minor in philosophical and religious studies, I went commissioned into the Army. And I kind of quickly figured out that wasn't going to be my cup of tea. I couldn't do that for very long, especially make a career out of it. So I got out of the Army, discharged out of the Army, and then traveled out west to Portland, Oregon. So it was just kind of like a foreign land. I was like, this sounds really interesting. And I was applying to neuroscience programs kind of all over the country, but I really wanted to stick out west because I lived in the South and stuff. When I was in Portland, I had discovered a naturopathic medical school. And I was like, wow, this sounds really cool. I was going to go be a surgeon. I had an uncle who was a doctor, and he's like, nah, he's like, you don't want to do that. Trust me, like, you won't have any time. You won't be able to have a family, which I know isn't 100% true, but he was like, you should stop thinking about something else. And so I found this other kind of medicine. I was like, wow, I was super attracted to that. So I did that. I got my doctorate in naturopathic medicine with a master's in medical research. And then I got a master's in Chinese medicine after that, and was practicing medicine, was practicing what I knew and had been trained in, and had always had an affinity for orthopedics. And joint injections, painful shoulders, backs, and musculoskeletal problems. And I did that, was like my main thing. And, I would treat other stuff in addition to it, but my main thing was injections. And I had a company approach me and say, hey, we're looking for, someone like you, an injection specialist, but we want you to inject stem cells into patients. And I told them no. I was like, I don't know anything about it. And they're like, oh, you can learn as you go. It's no, we'll help train you and we'll help teach you and send you to conferences and stuff like that. We just need an injection specialist, someone that knows how to inject. And so I went for it and started doing that for a little while. And then I didn't like the business practice of that company. They're out of business. So it doesn't matter who they are right now, but they ended up going out of business anyway. So I left them before they went out of business. I left and went back to my own practice, which I had kept open, and I had had other doctors working out of there. And so I went back and I was like, I want to do this full time, because I wasn't practicing stem cell medicine. I was practicing biological medicine as I would evolve my knowledge and learn. They weren't really practicing true stem cell medicine. They were ordering, which I'm sure we'll get into later, they were ordering biological products, commercial available products, and they were using that. But the changes that I had saw were really eye-opening. People with severe orthopedic conditions and pain for years and years, getting better within 1, 2, 3 months, significantly better. And I said, hey, there's definitely something to this, but they're not doing it right. I said, I want to do it right. I want to follow all this research that I'm reading, because if I'm going to do something, I'm going to do it right. And when I was working there, I'd started reading everything I could on stem cell medicine. And I said, well, I'm going to do it right. So I went and changed my clinic structure around a little bit, and then started practicing real stem cell medicine full time, and that was back in 2018.
How many patients have you treated since that time?
Oh gosh, I don't know. I sat down one time and I did count um, orthopedics only. Um, so I'd probably done back then. So let's say going into like 2019, late 2019, I'd probably be somewhere around 500 patients or so
Wow, 500 patients
that I
that
had
had
done.
stem
Yeah,
cells?
some sort of regenerative treatment.
Regener- Okay. That's a
Yeah,
lot. Wow. Okay.
yeah. So now I don't know. I got to be getting near 1,000, I would hope, somewhere
There
around
you
there.
go. That's awesome. Good for you. Well, hopefully that continues to grow for you, and hopefully the patients are seeing the impact as what the research
Yeah,
is showing, right? I mean,
yeah,
stem cells, it's a new field of medicine. Can you help? I mean, in the most basic terms, what are stem cells?
yeah. It's getting newer and newer. It's not so new. It sounds super new to some people, but we've been doing stuff with stem cells for decades.
Mhm.
Um, but you're right, like it's new in a sense to some, um, where some people are like, I didn't know this was an option. I didn't know this was an option for me. So when we say like, what is stem cell medicine or what is a stem cell treatment, we open up that can of worms and we're like, all right, well, what is stem cells? Like, what kind of stem cells are we talking about? I guess you could almost look at it as like an umbrella term when you're saying like herbal medicine. Well, what is herbal medicine? Or what is pharmacological medicine? Like you're using a specific kind of drug or some sort of plant as an herb, but what ones are you using? So stem cells kind of the same way. Stem cell medicine is usually using a specific cell type, which is called a stem cell,
Mhm.
and you're taking that kind of cell and you're using it for a very specific therapeutic purpose. So one of those categories would be bone marrow or hematopoietic stem cell, or cells derived from the bone marrow, which we've been using for quite a while when patient gets like has cancer and they get chemotherapy or something. It kind of wipes out their white blood cells, right? Wipes out their immune system. And so they would match a donor, a type, and then you would do like a hematopoietic stem cell transplant to up that person's immune system. So those have been around for a while. And then so people started experimenting with different kinds of stem cells over the past few decades.
Okay. Now, in terms of the stem cells as to how you treat patients, what is, I mean, can you tell us a little bit about that? Do you also do it from the bone marrow derived type of stem cells, or do you take a different approach in terms of treatment?
Yeah, I'd say the biggest ones are bone marrow, adipose tissue derived, and umbilical cord tissue derived. There is a lot of umbilical cord blood that's being used, cells from umbilical cord blood, and there's some from placenta and amniotic fluid, but not as much. But we specialize in umbilical cord tissue derived stem cells. So we'll say things like we'll shorten that to like a stem cell treatment. But for us, it means we're using mesenchymal stem cells derived from umbilical cord tissue.
Interesting. Now, is there a difference in terms of effectiveness compared to those different types of stem cell treatments?
So yeah, so depending on who you ask, they all kind of have the same mechanism. But bone marrow and adipose, what happens is as we age, and usually which goes hand in hand, as you have more disease or a longer disease, you kind of using up this internal store of these healer cells that you have. So I think I forget the numbers, but by 30, 30 on and on, your stores of stem cells drop pretty dramatically. So when you're taking from bone marrow or you're taking from adipocytes, from adipose fat tissue, you're getting less and less the older someone gets. And then there's the argument that these cells are less, but they're also older. They're not
Mhm.
working as hard and as good as they used to when we were younger. And so one of the big perks for umbilical cord tissue is that these cells are young. They already come in high numbers. They're a lot easier to grow and expand than, say, like a cell from bone marrow or fat tissue. So, in my opinion, the reason I claimed my stake with umbilical cord uh, cells is that, my bias is that I think this is the best cell source for regenerative medicine, and that's what I want to focus on.
Interesting. Now, I mean, I know you touched on it very briefly, but can you tell us some of, let's say, some of the common diseases or complications someone might have that you've treated using stem cells?
Orthopedics, for
Okay.
sure. So sports injuries, osteoarthritis, um, getting old itis, just
Mhm.
joints and cartilage wearing away. Um, so a lot of pain, basically, joint musculoskeletal pain. Really common, is probably might be the most well documented in the literature and in the peer reviewed research for stem cells. Um, Autism is getting really big. We treat a lot of autism at our clinic. That's growing in a lot of popularity. Cardiovascular conditions, neurological conditions, Parkinson's, Alzheimer's, dementia, stuff like that is getting really popular. Um, and yeah, you'll find, you'll of course you'll find smatterings of all kinds of different conditions. I'm actually still really surprised. I'm still learning so much, um, which is good. I feel like I have that philosophy, like you shouldn't stop learning. Um, but yeah, whenever somebody has a condition or something, they call us up. Hey, can stem cells treat this? I'm like, I don't know. I've never heard anything. I do, a PubMed research, or a Google search or something. I'm like, oh, I'll be damned. They there's at least a couple studies on it. But I would say those are a lot of the big ones, at least from being in the field and seeing what I've treated, at our clinic personally, but also just overall in the field of what other people are treating.
Right.
Orthopedics, autoimmune conditions, neurological, cardiovascular, and then yeah, you got liver conditions, kidney, failure. You got a lot more, so it's growing. It's growing a lot on what's becoming more and more popular.
That's awesome. Now, so let's say someone comes to you like, hey, I want to get treatment, right? What's like the common way of like how is it administered? The stem cells.
Depending on their condition,
Okay.
it's different administrations. IV is a really common one because you're getting this uh, systemic kind of effect. So if you have a lung or heart condition, um, veins going right back to the heart to get pumped into the lungs to get oxygenated, and then back to the heart to get pumped out to the rest of the body. So um, really good. That's probably it's why there's a lot of good reviews with those two conditions, because the cells, that's the first stop they're going. And one of the tricky things is if you're trying to get a systemic condition treated, you want to try to get the cells past the lungs, because one of the arguments against cell medicine is that the cells end up getting trapped in the lungs. Um, and so that's how they started looking at the secretions of the cells must be what's causing all the benefits. Because if the cells are getting trapped here, how are these other areas of the body getting better? So IV is really popular, and you just have to make sure you filter the cells uh, pretty good, because on a cell level, these are kind of big cells. You're still talking about in the micron level, but they're still pretty big as far as cells go. So for safety, you got to make sure you know how to administer them for IV. Direct injection for orthopedics is the best way to go. So putting them inside of a joint, along the spine, along the discs, um, along where a tendon is torn or a ligament is torn. There's intramuscular.
Mm-hmm.
So, just like a shot, like you're giving a vaccine, like it's a shot in the arm or in some sort of muscular area, and those have been shown that those cell deliveries stay in the body a lot longer than like an IV would. Um, but an IV route, you'll probably get quicker results, whereas an intramuscular, the onset of the gains of the improvements probably won't be as fast, but the cells have been shown to stay in the body a lot longer. So we're usually alternate those or do them simultaneously between an intramuscular, which is an IM for short, and an intravenous, which is IV for short. And then I don't know. I think it's a stretch to say I pioneered it, but um, we've been doing intranasal deliveries, and somebody's probably done it before I did it, but um, it was a cue that I took off of neurologists that were treating severe migraine and headache problems. And they would take this specialized catheter, you thread it back while the patient lays down, you thread it back into the nose. It doesn't hurt. It's irritating, I guess, sometimes, maybe even a little ticklish. But you thread this back down there, and this specialized catheter aims at this bundle of nerves and blood vessels called the sphenopalatine ganglion. And you can squirt, squirt in both sides and administer them intranasally. And that's a better way, in my opinion, to target anything neurological. I think more cells are going to get delivered to the brain than they would in an IV, and it's a lot safer, and you can administer it more than you could with an intrathecal administration, which is where you inject them into the spinal fluid in the spinal cord.
Mm-hmm. Interesting.
But those are the biggest ones we do: IV, intraarticular, inside or around a joint, intramuscular, and intranasal.
So let's say someone comes in, they get the treatment. How long does it take for them to see results?
Oh boy, that's the $1 million question. That's another one we get asked every day.
Uh-huh.
It depends. Orthopedically, I my what I tell my patients my Goldilocks zone is 2 to 4 weeks. So about 2 to 4 weeks on most instances, you should start seeing some sort of a change, and uh, there's all kinds of different ways of change too, or improvements. I have the stem cell lottery winners, which is those that just take off. Like they get a treatment, and like within a week or so, they're calling you back saying, "Oh, you're a miracle worker. Thank you so much. I'm feeling 10 times better." And so that's not the norm. It's not. But you have the steady kind of increase where within that first month or so, it's getting a little better, it's getting a little better, it's getting a little better, and they kind of just stay on this steady increase. And you also have this peak and trough kind of improvement where you may not really see much, and then they'll show a little improvement, but then it'll go back down a little bit. Their symptoms will kind of come back, and then you'll wait a little bit, and then it'll go up, and they'll say, "Oh, I saw a lot of improvement for like a week, and then my symptoms kind of came back." And then so you got this roller coaster effect that can happen, and then you got the low and slow ones where not really much is changing, a little bit changing, not much changing, a little bit changing. So you have these different patterns of healing, but orthopedics, I say 2 to 4 weeks, and sometimes it takes as long as 3 to 6 months.
Mm-hmm.
With autism, because that's probably probably the most we treat. We do a fight between autism and orthopedics, but autism, we see certain symptoms change faster than others. So, like a child's sleeping patterns, a lot of kids with autism have a lot of trouble sleeping, going to sleep, staying asleep. They'll wake up all throughout the night, and so not only is this tough on the kid because they're not getting appropriate amounts of sleep, it's super tough on the parents. Like I'm in my bedroom right now because my 5-month-old is sleeping, and so I didn't want to be in the office, which is next to her room, And so, yeah, it's super important for them to sleep, and that's when we heal and grow. And so the parents are also exhausted because they're not sleeping that good. So one of the earliest things to change is their sleeping patterns. They'll fall asleep faster, and they'll stay asleep through the night. And then you have things like attention, their attention span, listening skills, affection. So actually engaging more with other adults and other kids. And then you have some of the longer, like we're 3 to 6 months out, you might start seeing improvements, which is like communication, verbal communication, starting to form words and sentences. That can take well into 3 or 6 months, and some kids even longer. So it's kind of a tough timeline to peg down on when someone is going to start seeing improvements. We just started on a couple new Parkinson's patients and Alzheimer's, and yeah, so it's certainly nothing to write home about right off the bat. But for serious chronic conditions like that, like it could be 3 6 months before we kind of start seeing some. And another one of our he wasn't, his neurologist said he wasn't technically diagnosed with Alzheimer's. They diagnosed with dementia, but they said if you come back within like 6 to 12 months, you'll probably be diagnosed with Alzheimer's. And he took off like within a month or so. They were, him and his wife, or it was mostly his wife, was calling us back saying he's doing amazing. Like he was having trouble walking. Maybe it was Parkinson's that was going to be his diagnosis, but they diagnosed him with dementia. It was going to be Parkinson's, and he's like, he's walking better. He can walk in a straight line now. His memory is like isn't nearly as bad as it was. We don't have to ask him. Well, the wife was like, I don't have to ask him the same things over and over again. I was asking him the same questions over and over and over again. And so now I just ask him once, twice sometimes. And so, yeah, it's kind of all over the board. General rule of thumb is, I probably should have started with this. I apologize. General rule of thumb is 3 to 6 months.
3 to 6 months. Okay. Now let's say if it is like a chronic condition, right?
Yeah.
So let's say if they start seeing improvements 3 to 6 months. Is it like a set of treatments they do? Is it a one-time treatment, or is it also like a chronic regimen of treatments?
Definitely depending on severity, I always recommend a series of treatments.
Okay.
I think this is where a disservice is being done with overseas clinics. It's kind of like a medical tourism kind of a thing where they're trying to get people from other countries to fly here, and you stay for a couple days, which I guess technically they are administering multiple treatments, but I guess it's anecdotally for me. I find the improvements last longer and become more significant when you get a treatment. Even if we do a treatment for a day, or if we do like a treatment on a day and they come back the next day and they come back the next day, and we do treatments each day. And if they come back within like 3 months and you can do it again, I find it gets almost like this compounding kind of effect, where the effects get stronger and stronger the more you do. So can you get some really, because it's stem cell medicine, because it's really amazing and cool? Yeah, you can definitely get some really great results just coming and getting one treatment. But I find it's much more hit and miss. The patients in the past of mine that have come and gotten just like one treatment, and they're like, no, mostly it's, I get it. It's a stressful thing to have to fly to another city and stuff like that to get a medical treatment, but it's money. It's more money, and stuff like that. So they're like, no, I just want to get one and see how it goes. I find that's where it gets a little more hit and miss.
Okay. That makes sense. So let's say even if let's say there's a set of treatments someone's getting, let's say for like Alzheimer's, right? Or something like a progressive or chronic disease. What I'm curious about is, are there any risks in terms of the long term? Let's say someone just keeps getting stem cells. Is there any risks, or is it mostly just benefits that they can get, if anything?
I don't think so. As long as the practitioner is doing it right.
Okay.
Sterility, safety, is using a good cell source. It looks pretty safe. It's been quite a number of peer-reviewed research that says, we didn't see any adverse events or any adverse effects. It's a safe and well tolerated treatment, should be considered an option, blah, blah.
Hmm.
You get kind of tired of reading the same conclusion from all the papers.
Right,
Um,
right.
uh, yeah, it doesn't look right. And I mean, and that's where things get a little sticky is I'm really only quoting for bone marrow, adipose, they seem to be pretty safe, but I don't practice those. But umbilical cord tissue, um, it seems to be safe as long as you're doing it right.
Okay.
And there was some cases, there was where was it? Somewhere like I feel like in East Europe or something where they did a transplant. I think they took cartilage from the patient's nose, they grew the cells out, and their theory was they were going to put that into the cartilage in his low back and just have it proliferate and grow and heal his back injury. And
Hmm.
well, I guess 5 years later, he ended up having a tumor diagnosed. I guess where this in the area that the cells went in. Um, so it definitely, I mean, it matters the cell type,
Hmm.
um, and if you're and what you're doing with it for sure.
Interesting. No, and it's funny you brought that up because I remember a story like that. I was like, man, are there any risks? But thanks for kind of
Hmm.
clearing that for a lot of people. I mean, like myself, so I'm curious. Hey, what are the type of risks? Could they just be at a point where they're getting multiple treatments and there's a point where they might not see any improvements anymore, but their disease could be
Yeah,
progressing? Or have you come
yeah.
across
I
something like
mean,
that?
the optimism in me says like, well, are we using enough cells? Are we using of the is the dosage good enough? Could we do more? Um, but yeah, I mean, we've had some. I guess I'll call them like failures. Like to me, like the patient didn't see the results they wanted to see. We treated a patient with cerebral palsy one time, and she never improved. And I know there's some pretty good research out there on cerebral palsy and stem cells being very effective, but this patient had shown like minor improvements like one time. And that I remember being the best were hopeful that I was, but most of the time she didn't. And that was a couple years ago. I think she ended up passing away like a year or two after we treated her. Um, so yeah, does it happen? And it's one of the downsides is that a lot of people spend money to go get these treatments, and it's like, well, the worst that's going to happen, it's really proven to be really safe. The worst that's going to happen is nothing. It's not going to improve you, and
Right.
you spend time and money, and that sucks. But you're not going to get any worse supposedly from any of them, and I've never seen anybody get worse from the condition. It's just like you said, like it it didn't really do anything or do much.
I mean, just kind of with your experience going through all of this, let's say someone's a patient, they want to explore getting stem cells, right? What would you
Hmm.
advise somebody, whether if they want to go to any clinic here in the US, Mexico, or anywhere? What would you advise
Hmm.
that the factors they should consider before choosing where they want to go to get a treatment?
Oh man, homework. Do your homework. Read about it as much as you can. Um, look into places. Go with your gut feeling too. Um, just whatever gives you a good sense. Don't chase the bottom dollar. Um, I think a lot of people have gotten in trouble with emphasizing the money they're going to spend, and they let that dictate where they go and what kind of treatment they get. And actually we had a patient fly in from Ecuador um, these past couple of days for treatments, and she said it best today. She said, "Oh God, how did she put it?" She said, we really want to come back for more." Because we end up spending money on all this stuff that we don't use or don't need, but we don't focus on. Well, when it comes to our healthcare, we sit there and question the amount of money we should spend. And
Hmm.
I was like, you said that so perfectly because I think too many people do put that as a big divider on their on if they're going to get health or not. Is cost is a huge factor, and it's so hard because there's some places out there charging like $20,000 for like a single procedure, and they're not even like giving much. So I think, doing your due diligence, look at things like Google reviews. Health Grades is a site that, like, it's kind of like a Yelp, like how Yelp is really big for restaurants. Health Grades is like specific for doctors,
Okay.
um, and them getting reviewed. So look at the site, Google the site, maybe check out other forums or something where you can find like something that's not biased. Because yeah, you can go to you can go to our website and you can read lots of testimonials, and they're not fake. I promise they're not fake. They're all true. But a company, a clinic could just put a websites. All our testimonials, 100%. Those are patients. But if you only go by that, some places do get a little gimmicky. That you can tell they're run by marketing experts. They're not run by medical experts. Um, and I end up looking into a lot of these because people call in or email or whatever, Facebook, and say, I'm thinking about going here. What do you think about this place? And so I'll look into some of them. I'm like, right off the bat, it's run by a marketing company.
Yeah.
You can tell. Um, so you have to pay for all that marketing. Those treatments are going to be expensive. I always find those places have very expensive treatments, and you're not getting much medicine for your buck. Um, so yeah, just look into it as best you can. Call and talk. This is a big decision in your life. It's going to cost a lot of money. It's going to be a lot of your time, especially if you have to travel, out of state or something. Call and talk to those people. We do consultations for free. And I've had a lot of feedback of patients saying, or potential patients saying, well, sometimes they'll say like, let me know as soon as I can to get into your clinic. I want to come there. Or they'll say like, we're going to think about it, but really appreciate the genuineness and being able to talk to you. When we called like 3 other clinics, we talked to a salesperson, and I just feel like it loses a lot of the luster of like having a medical procedure done when you're talking to like a salesperson or something like that. So I guess, do your homework, do your due diligence, and go with your heart, go with your gut instinct.
In general, in terms of the treatments here in the US and let's say overseas, like Mexico or Panama, those are common places of medical destinations. Um,
Mm-hmm.
what are like some differences that you would say in terms of just going to somewhere there or somewhere here?
Well, trying to think of the most diplomatic way to say this without clinic, without bashing anybody, um, or trying to sound too negative, because I'm very much cooperation over competition.
Hmm.
Um, and a lot of overseas clinics have made it very hard for me to stick to that. Um, some of them would get very expensive.
Hmm.
$20,000 for a single procedure. That's not even more than 100 million stem cells, and 100 million is a small dose. And they have a good reputation, and they have good success, but they also have a bit of good marketing magic, and they have a lot of where you're paying for a brand name almost, where you know they've just become so influential that it's almost it's almost therapeutic itself for people to say, I'm going to clinic such and such. I'm not going to name it, but I'm going to this country. I'm going to this, clinic. And it's like, all right, well, you could have stayed here in the States and got like 4 times the treatment, the medical care for the amount of price. But to them, it seems very, um, I don't know. It's very rewarding or something for them to go. And then, so you have this kind of extreme where there's places overseas where they're charging very, very high, exorbitant prices for the medical care. And they do offer good medical care. Like, they obviously didn't get there, they're obviously got popular and famous for a reason. But now there's other places that are like, well, we can do the same thing and even a little better for like fraction of the cost. And then you got the other end, which tends to be a lot of the clinics in Mexico. And I have more of a beef with the Mexican clinics because I've had a couple of them actually reach out to me, and I had one which I won't name it, even though I almost feel like it would be more of a service to name it. But I had one where the owner reached out to me and said, "Hey, we want to sell you live stem cells, fresh." No, you said fresh and live, and versus cryopreserved, where they're frozen,
Hmm.
like -80 degrees. And I was like, well, I was like, what do you mean, sell me fresh stem cells? How are you gonna sell me fresh stem cells? A fresh stem cell procedure has to be done like on site. Like you're growing these cells, they're in their little media, they're in their happy little home of nutrition and stuff like that they can grow in, and then you have to take the cells and then you have to go put them, do the treatment like right then and there. They're going to be dead in 30 minutes or an hour if you take them out of this little home that you made for them. And they said, oh, we'll mail them to you, and we have the best, freshest cells, and we're shipping them to all these clinics in America. And I was like, well, how are they fresh if you're mailing them to me? They skirted around the question. They didn't answer it, and they just kept saying, yeah, we've had the freshest cells, guarantee you. And I was like, I can't do this. So like, there's clinics in like Mexico and probably other places that they're just outright fabricating things and outright lying, um, just to get patients to go to them. I've seen a lot in Facebook groups where they have representatives go there and lie about other clinics. My clinic has been a victim. I've had other patients call us and go, hey, we want you to know such and such on the Facebook groups is 100% lying about your clinic. And they're recommending them go to these other clinics because they get kickbacks. They get free stem cells, or they get a commission or something. So there's a lot of shadiness in some of the overseas clinics, and that really bugs me. Um,
Wow, I've that's really
yeah,
interesting to hear. You would not think that you would hear stuff like that. So that's part of
I
your
think I
battle
think there's
with
good
that
ones.
information.
I'll say I think there's some good ones for sure.
Yeah.
Um, I've had patients tell me, yeah, I went to Mexico because I wanted to get it. It was cheap there, and I have severe low back pain, and they gave me a shot, and it just didn't do anything. Like, what do you think went wrong? Like, why didn't the stem cell treatment work? And I was like, well, hold on. What do you mean they gave you a shot? And she said, well, they just gave me a shot. It kind of felt like it was maybe in my upper butt or somewhere in my low back area. I couldn't tell, but I just got a shot. And I'm like, you have severe damage to your, you know, your low back area, your SI joint, your lumbar spine. And I was like, they just gave you one, and so you also get untrained professionals. And I think she ended up finding out that doctor that gave her a shot was actually an OBGYN, and they'd convinced her to come in for a pretty serious lumbar procedure, and they had an OBGYN do it and just gave her a shot in that area. And I'm like, that's 8 shots minimum. You got to get your vertebral facets on each side of your lumbar. You got to get the pelvis and the SI area. And I was like, you should have had a lot of shots for that. So I just hear a lot of stuff about those clinics. So yeah, make sure you do your due diligence and really find out the best you can, um, about where you're going, who's going to be doing your procedure, how many procedures like that have they done? Is this their first? Is it kind of new? That's fine. I'm transparent with people if I'm like, I don't know, I haven't done a lot of those.
Hmm.
Um, had a girl with a 16-year-old with dystonia come in. She got put on an SSRI, uh, Zoloft, and became dystonic. Like her muscles started seizing and contracting up, and so I told him, I was like, I haven't done anything like that yet. If you want to, entertain the idea, we can. But so they should be very, transparent with you as well.
You've been practicing the regenerative medicine for quite some time now. Can you talk about maybe just some, or maybe like a promising finding, or just like a major breakthrough that you've done recently within just your research within that field of stem cell therapy?
A major breakthrough. I wish I could answer this question in like 4 to 6 months. We're building a bigger and better lab.
Okay.
Um, and I think we're going to be able to do a lot more cooler stuff um, with that. But man, cool. I mean, some of the coolest stuff is, I don't know if it almost sounds normal to me now, but it
Mm-hmm.
might to other people sound like, it might sound very cool. Is just getting people like severe orthopedic conditions, like I can barely move and walk anymore, getting them back to, functioning nearly 100%. Um, Low back pain, hip pain, where they're just like, I can't, I can't even stand up straight. I can't even like sit up for more than 30 minutes. Um, I had one patient who was on, he was on morphine. He got hit by a car, and he was on morphine like every day, and he was like, I just can't function unless I have like morphine. I was like, yeah, that's strong.
Right.
So to get him back to a place where he was like, I don't need that pain medicine anymore, I think that's pretty significant and pretty cool.
So how did you go about
The
doing that?
work, how did I go about doing it?
Yeah, how did you go about doing that?
He he was just a series of injections,
Okay.
low
Very cool.
back, low back area, along the spine, um, and anywhere that he had problems or his imaging had showed problems. I always merge the two. I never just go off of MRI or just imaging alone. Um, I kind of trust more the patient subjective experience of where they're having their pain and what physical movements they can and can't do tells me what biomechanical forces are being applied to different areas. And I'm like, all right, that helps me hone in a lot better. And then you got this nice imaging, this MRI report was like, oh, well, it kind of shows like, you know, some disc herniation around L4. Like we probably definitely want to show, give that area a little love. But I'm sure if we talk long enough, more and more stories would pop up. We have had some
Yeah.
great autism cases, really great autism kids that we're doing some work, but the parents are really you know the unsung heroes, I think, and their therapists and stuff like that. But the stem cells obviously made a huge difference in their life because a lot of these autism families with autistic kids they've done everything under the sun, it seems like. Um, but when you see a kid being able to talk fluently, like form full sentences, um, engage others, like you think like a 5 or 6 year old would. That's pretty rewarding and that's pretty significant.
That's great. I mean, going towards the kind of aspect of the imaging, right? When you're looking at symptoms and imaging, when you're looking at some of these diseases, let's say related to the brain, do you see any
Hmm.
ever like type of changes within the brain after stem cell therapy treatment? Because a lot of times there's atrophy going on. Do you ever see reverse or anything of that nature?
I don't, because I haven't been able to get my patients to go into the MRI.
Okay.
Yeah. Actually, speaking of with the autism or the Alzheimer's patient, she was in today, and son, said, well, now she instead of only being able to remember like what happened yesterday or maybe 2 days ago and nothing past that, he said she's remembering weeks ago, and certainly engaging with her has been a lot different. The more treatments that we do. She remembered, that I had a daughter from, five, and she remembered that she bought us a gift. She brought my daughter gifts. Um, and so she's certainly communicating a lot better. Her son and family says like her personality is like coming back and she's much more engaging and remembering things like she couldn't. She was one, I wanted her to take this very specific MRI, and she couldn't. They can't do it. So actually, catching imaging is pretty hard to do. I don't know if other clinics or doctors in this field have as much trouble as I do, but it kind of seems when somebody improves or they're doing better or they're better, they're kind of like, why? I don't want to go do that. Like I don't want to waste the time and money.
Right.
So I do have a hard time getting people to follow up on their imaging reports. Because I'm not a controlled study. Like
Right.
um, I'm not making them do it. I'm encouraging them to. I mean, it'd be nice if I had like a little an MRI in my clinic. That'd be awesome. But otherwise, I've had a tough time getting imaging follow-ups.
Okay, I hear you on that part. Um, Last question: where do you see this type of treatment, stem cell therapy treatment, going within the future? Where do you see this? What type of role do you see this being in the future of medicine? Let's say 3 to 5 years from now.
Oh boy! Hopefully, in 3 to 5 years, we can get our act together and just accept it more. I am still a little leery if I want insurance to take over on it. I don't mess with insurance. I never have. I think I just not my cup of tea. I don't like what they do to the patients, to the doctors. I just don't like the way they function. But if we could find a way to make this kind of medicine more abundant and more affordable, I think it would help in emergency setting, um, in a palliative setting, like instead of steroids injections, like why not do a course of stem cells? Like put 25, 50 million cells in a joint when they're complaining about pain, and then see how that goes. Or do both. Put a steroid injection in, and then put cells in right behind it, and so that you can turn off that inflammation. Hopefully get a lot of inflammation in the joint down, and have the cells come in and do regeneration. Um, Emergency medicine, strokes, heart attacks, or something. Start pumping these cells like right away, right when they come into the hospital, or keep them in the ambulance. Um, would help a lot of orthopedic surgeries. A lot of surgeons would probably be converting into learning this kind of medicine in addition to surgery. And you save these surgeries for like car accidents, and people are probably still going to need surgery eventually in some form or fashion. But why not do this first? Give this a good go, and then save the surgery for in case you need it. Same thing, autoimmune conditions. Why not have this accessible and do this as a form of biological medicine instead of immune suppression right off the bat? These really hard drugs that a lot of people are having bad side effects from. So there's just so many different applications I see in 3 to 5 years, them being incorporated a little more mainstream, and at least given an opportunity more.
Dr. Travis Whitney,
Yeah.
thank you so much for your time. I really appreciate it. Let's say if any patients they're looking to get a stem cell treatment or they want to get a hold of you, is there a way they can contact you? And if so, what would be the best way?
Yeah, our website's got a ton of information. I just uploaded a new FAQ, frequently asked questions. It was like 30 pages long on my Word document. So it's very detailed. We put a lot of information in there for people. Our clinic line is 602-603-3118. Our website is innatehealthcare.org. So innatehealthcare.org. And our email is info@innatehealthcare.org.